Hello and welcome to another episode of Coffee Time. Today I am sitting with the Dean of the College of Chiropractic. So let's welcome Dr. Katie Burns-Ryan.
Thank you.
Thank you. Cheers.
Cheers to you. I'm going to let you in on a little secret.
Okay.
I don't drink coffee, so it's more like hot cocoa or water time for me, and that's
all right.
okay.
Noted for next time. Hot cocoa with Katie. All right. So how long have you been serving as the Dean of the College of Chiropractic?
So I've been the dean for 5 years.
Okay.
But I've been with Northwestern for 20 years.
Wow.
So I started off as a clinician in the Durusha Clinic, as well as teaching physiology labs.
Okay.
Found that I have a passion for both. I love seeing my future colleagues as they progress through the program, in the clinical side, in the didactic side.
Sure.
And so I kind of weaved my way, mostly on the clinical side. I became a chair of a department, though, and then after that, I began running the clinics, and then the dean's position opened up, and I jumped at the opportunity.
Amazing. And loving it, right, every
Love
day?
it. I do.
Good. And you're an NWHSU graduate yourself.
Yeah.
So, first off, I just want to know, what is an embarrassing story that you can share with all of us from your early days in school?
From my early days in school.
There's got to be something.
This is one that I freely share at Discovery Days and with students, but Northwestern has always been very hands-on in their labs and gotten students adjusting each other in labs very early. And I remember my very first adjustment on my bestie from school. Her name's Janine Johnson. She's from Canada. And I was adjusting her neck, and I had Dr. Bergman standing over my shoulder, and I adjusted her neck, and I just got so excited, I totally dropped her head onto the table, and I was like sweaty and nervous, and Dr. Bergman leaned forward and said, "That was really good, Katie. Next time, just don't drop their head." And I'm proud to say that since then, I have not dropped anybody since that experience.
Good,
Yes.
good. You heard it here. Nothing to worry about. And, okay, on a more real note, what changes have you seen since you graduated?
Well, on the academic side, we've had some huge strides in being able to utilize data to support student progression, to identify when a student might need some individualized attention.
Okay.
When I was in school, I had like a midterm and a final in my exams, as well as a midterm and final in clinic. And it wasn't enough. You know, you've been in clinic for 6 weeks, you think you're doing just fine, only to find out, wait a second, I need to change how I'm performing an orthopedic test. And so really the direction for academics that I've seen is that we have so much more technology to support students and to identify their trends and where they need improvement. We can step in earlier and provide additional remediation, and the students are in the driver's seat. They have dashboards that show them exactly where they're at in the program.
That's cool.
And it's really nerdy, but it's exciting. So that's the academic side.
Right.
I would say a career in chiropractic, when I got out, pretty much your choice was to go into private practice and either associate with someone, or start your own practice, purchase a practice.
Right.
And what we're seeing now is much more diversity in chiropractic and where you can go. Certainly we see people go into private practice, but we also are seeing huge increases in the utilization of chiropractic in hospitals, in large multidisciplinary settings, in the VA. That has been a huge leap in chiropractic. And we're also seeing chiropractors specify in particular areas.
Oh, that's right. Yes, I've noticed that too.
Yeah, and so when I graduated, that wasn't really that much of a thing.
Okay.
But now we're seeing doctors who are really focused on things like pediatrics, sports and rehab, which is a big one at Northwestern.
For sure.
Animal chiropractic. And then we see people who are going into other fields, using their chiropractic degrees, but in totally different ways. Research is exploding, policy is exploding. So there's just much more diversity when it comes to your career. It's fantastic. Yeah.
That's super exciting for a student. And, where do you hope it goes from here?
Well, I would say first and foremost, more research.
Okay.
We are
Pushing
seeing
the
some
research.
fantastic information coming out of the National Institute of Health. We're seeing information coming from our neighbors to the north, Canada.
Okay.
The UK has some fantastic research that's coming out about musculoskeletal care. But I want more. Every time something comes out, it just further refines what we can do for our patients. Maybe it's about an exam, maybe it's about a treatment methodology, but it's all about what makes better outcomes for the patient. So that's number one. I want more research about chiropractic, about musculoskeletal care. And then the second would be utilization. At around 15% of US adults seek chiropractic care annually.
That's not a big number.
That's not a big number.
That's surprising.
It is. And so what I would really like to see is just more chiropractic utilization. A chiropractor in every small town, a chiropractor in every hospital. The VAs are growing right now, so I love the direction that's going. But just increasing that utilization and providing opportunities for patients to access chiropractic. Yeah.
Beautiful. I love that. And under your leadership, the College of Chiropractic is currently implementing a competency-centered curriculum. So can you explain a little bit more about what that means and why we're making this change?
Sure. Do you have like a couple hours? Because I get really excited about this.
Maybe. We'll have to do a round 2, round 3.
So about 2022, as the COVID pandemic was coming to a close, the college realized that prior to the pandemic, we really hadn't done a deep dive into our curriculum. We didn't need to. We had had fantastic outcomes prior to that and through the pandemic. But the pandemic forced us to modify how we taught.
For sure.
What the learning experience was. And so we embarked on a curriculum transformation process, and we really reached out to faculty, to students, to alumni, to groups that we collaborate with, and identified some primary goals. And one of our goals was to be going in the direction of a competency-centered program. And what that really means is it values what a chiropractor needs to be able to know and what a chiropractor needs to do.
Okay.
So when I graduated, if I passed a class, then great, you just keep moving on.
Okay.
We're going deeper than that. We're really looking at how classes are put together so that it's very focused on those skills, on that knowledge, and we assess it specifically to ensure you didn't just pass a class, but you actually passed all of the specific elements that are important in that class. Nothing gets left behind for our students. I'm really excited about that direction. I think it's going to close some of the gaps for our students, especially the gaps we see between the didactic side and the clinical side. We'll occasionally see or hear where, a doc will say, that student struggled with taking a blood pressure. It's a bad example, but it's an example.
Sure.
And we'll know that it was taught in a class, right? Now we're getting to the point where we can say, all right, not only was it taught in the class, but that student was assessed and they met the requirements for that particular skill.
Got it.
And then the student doesn't struggle as much when they get into that clinical environment because they've already demonstrated that level of skill. So
yeah,
I'm very excited about it.
I can see that. You're passionate about it. That's great.
I am.
That's great to see.
I am, yes.
I'm excited to hear about how it progresses.
Thank you.
And as a university, NWHSU is focused on person-centered, evidence-informed healthcare, right? When you think about the future of healthcare in the U.S., where does chiropractic fit? You already talked about seeing more people using chiropractic care, right? But what else, and why is it important that a chiropractor have a seat at the table?
Sure. Well, U.S. healthcare is finally catching up to chiropractic. I will say that, and to Northwestern. Patients, people are expecting that it will be evidence-informed, and it's important to know that evidence-informed, it isn't just research. Evidence-informed is actually What is it that the patient needs, wants, what's their experience, what's their goals? Incorporating them in every aspect of their care. Then there's the clinician's experience. What have they learned? What have they utilized for other patients? What's been effective? What hasn't? And then on top of that, incorporating current research. All of those pieces coming together, and the US population expects us to lean into all three areas of evidence-informed practice. They're also expecting that we as chiropractors are excellent chiropractors, and that we also see when we need to collaborate with someone else. My clinicians in the Human Performance Center, they are my go-tos for rehab because that is not my background. They're phenomenal, and I should be collaborating to get the best possible outcomes for my patients.
Definitely.
And so where chiropractic fits in is more and more research showing that looking more holistically, thinking about musculoskeletal complaints in a way that's non-pharmacological, that is non-invasive, and really helps the patient create change in their life that is impactful in a healthy way. Chiropractors are ripe for this. This is something that chiropractic has been doing for years and years and years. And like I said, the US healthcare system is finally catching up.
Yeah. It's about time.
It's about time.
Fantastic. Well, I loved chatting with you, getting to know you a little bit more, and just talking about your passion for this field and where you see it in the future. So thank you so much for being here.
Thanks for asking.
Until next time.
Until next time.